While performing, all that matters is the music and rhythmically driving the band through each song. All of the aches and pains vanish from consciousness. As the performance progresses, I unknowingly tense up and slouch while playing, responding to the bodily fatigue. It is amazing how I can go on playing this way for hours, unaware of my poor posture that adds stress to my body. Only sometimes will pain emerge into consciousness and break my focus. It is this pain, beyond the regular aches and pains of drumming, that tells me that I've let the wear and tear go too far. It is in these moments that I begin to question if pursuing my passion is worth it. Hi, my name is Jenny Seaborn. As a professional drummer, I struggled with the playing-related musculoskeletal disorder, or PRMD, de Quervain's tenosynovitis of the wrist, which hindered my ability to play drum kit during my final year of Bachelor of Music study and disrupted my career as a performer and drum kit instructor. Thank goodness I'm all better now, but at the time it was really difficult. I sought out professional medical care, which was helpful, but I knew that these professionals would have limited knowledge about the specifics of drumming and its career demands. I struggled to locate information on the experiences of drummers affected by PRMDs. Consequently, I lacked models on which to base my navigation of injury. Through Carleton University's Faculty of Arts and Social Sciences Summer Research Internship program, I completed this study after a beating Drummers' Navigation of Playing-Related Musculoskeletal Disorders. Most research studies on PRMDs among musicians focus on statistics, medical perspectives, assessing injury risk, and anatomy-based prevention and treatment methods. By contrast, this ethnographic study aims to provide insight towards the lived experiences of drummers navigating PRMDs and thus fill a gap in our understanding. My research asks, how do professional drummers approach PRMD recovery and prevention? What unique challenges do they face while navigating PRMDs, and do they have methods of overcoming such challenges? Are there recovery and prevention practices that they find practical and effective? It's super important to recognize that PRMDs are not simply medical events. They can impact various aspects of drummers' lives. This is best captured through examining the lived experiences of drummers. Data derives from interviews with 10 professional drum kit players with a current or past history of PRMDs. This study defines a PRMD as a drumming-induced injury or disorder that affects the musculoskeletal system, for example, muscles, tendons, ligaments, joints, nerves, and discs. Participants remain anonymous and display diversity through the musical genres they play, age, and gender. Following the interview process, the data was coded for common themes. Detailed findings from this study, including the stories of participants' experiences and my own, are included in the study's research paper, which is currently unpublished. The goal of this video is to summarize the study's findings. It's very important to note that this is not a medical study, nor does it serve as a guide to injury prevention and treatment. Rather, it provides insight into how professional drummers are choosing to navigate challenges, treatment, and prevention in relation to PRMDs. The PRMD treatment methods used vary among participants dependent on the individual and their particular injury. However, some commonalities are evident. 6 of the 10 participants found that some form of stretch or exercise was an effective treatment for their injury. Notably, 3 participants found using resistance bands effective. 7 participants identified types of medicines or drugs as ineffective or avoided treatment methods. Hesitancy towards pain medication was common and was due to either experiencing or being warned about side effects. 4 participants found that rest and taking time off from drumming was an effective form of treatment. 1 participant found that it was somewhat effective. 2 participants, one who took a year off from drumming and the other who had not played drums in months, are uncertain whether or not taking time off is a factor contributing to healing. In contrast, another participant who took an extended amount of time off found that the break was great for his body as it eliminated various aches and pains. Furthermore, of the 5 participants that used a brace in order to treat their injury, 3 found that it was an effective treatment method. 1 participant found using a brace somewhat effective, and 1 found it ineffective. 9 of the 10 participants sought out professional assistance while experiencing a PRMD. Only one of these 9 got help from only one type of professional. Results suggest that trial and error often occurs when seeking effective professional assistance. A medical general practitioner was considered ineffective or avoided for 3 participants. Reasons include a bad experience, pushing pain medication, and not offering useful injury assistance. 5 participants identified general practitioners as being somewhat or temporarily effective for reasons including being able to diagnose and offer referrals. All participants made some form of change related to drumming and/or drum equipment in order to prevent further injury. This will be discussed a little bit later. A very common recommendation is to do an instrumental warm-up and stretch before performing or practicing in order to prevent injury. Interestingly, 4 participants indicated that they do not regularly stretch and warm up before playing drums. In some cases, participants chose to warm up and/or stretch contextually. For example, higher volume shows or more physically demanding drumming. For other participants, stretching and warming up just simply does not appeal to them. One participant described it as being boring and said he would rather jump right into playing. Another participant only does a warm-up occasionally before drumming for the purposes of being able to drum his best after periods of not playing. This demonstrates how for some drummers, warming up may be tied to improving technical facility rather than injury prevention. Drumming-related risk factors highlighted by more than one participant relate to improper posture, fast speed, extreme volumes, increase in amount of playing, improper technique, repetitive motion and overuse, vibration, positioning of drum kit components, using heavy drumsticks, and sitting for long periods of time. One participant described being in a state of trance playing drums. It occurs when he is performing songs that he is comfortable with and that he has played many, many times with musicians that he musically meshes with. The trance results in feeling like time flies by when performing. This connects to the concept of flow. Flow theory was proposed by psychologist Mihai Csikszentmihalyi and can be defined as a subjective psychological state that occurs when people become so immersed in an occupation that they forget everything except what they are doing. The participant acknowledged how this state could possibly make injury more likely to occur, as you don't notice possible hazards. He gave the example of a hi-hat slipping out of position on the floor and only noticing when a finger gets caught in it. In occupational science, flow is often tied to a positive state of health and well-being. This participant highlights an area rarely explored, the negative aspect of flow potentially causing PRMDs. The study, Survivors on the Edge, the lived experience of professional musicians with playing-related injuries, found that some interviewed musicians were taking steps to avoid flow when playing their instruments in order to prevent injury. Modifications that participants made in response to PRMDs include changes to drumming technique, including bodily changes, drum kits and drumsticks, drum kit transportation methods, as well as musical changes. Some trends that emerge include incorporating different types of grips, techniques, or strokes into one's drumming in order to prevent overuse of one particular motion, making adjustments to drum seat height or the type of drum seat used, switching to lighter drumsticks, and increased focus on relaxation and ergonomics, using molar technique, making adjustments to lighten the load of equipment used for gigs and transporting equipment on wheels, using a brace while drumming when injured, using fingers more when producing strokes, playing simply while injured, making improvements to posture, and avoiding overhitting. Many participants, post-injury, have continued to employ the modifications that they made while they were injured. An exception is the use of a brace while drumming that was only used by some participants during their injuries. 2 participants commented on how they were still able to play drums when using a wrist brace, but they actually had to modify their approach to limit wrist use. For one drummer, this meant using her fingers more to produce strokes. A downside of a brace mentioned by a participant is that it makes muscles in other locations tense up unconsciously. This is due to bodily compensation for the injured area being restricted in motion. Another downside mentioned by a participant is that a brace acts as a resistance and an extra weight on the injury site, causing pain. He described having to consciously not do the motion that was being restricted in order to prevent further injury while using a brace. The participants' experiences demonstrate various emotional, psychological, cultural, and economic impacts of PRMDs on professional drummers. Their stories provide insight into how they chose to approach particular challenges that resulted in these forms of impact, and if possible, overcome them. Challenges discussed by more than one participant are related to accessing professional care, the cost of professional care, struggles with insurance coverage, lack of understanding from medical professionals, pressures to maintain high performance levels, inability to meet a required or desired proficiency playing drums, having to limit time spent drumming, discomfort with receiving assistance while injured, uncertainty surrounding treatment and prevention options, as well as issues related to the inability to or having to turn down gigs. Many of these challenges resulted in more than one impact. For example, one participant described having to turn down gigs while injured, which reduced his income, and he was afraid of people not calling him in the future for gigs if they knew that he was injured. In this case, having to turn down gigs resulted in economic impact as well as emotional impact, as he feared the potential cultural impact of people losing interest in working with him due to the injury that he had. 8 of the 10 participants described an emotional aspect to their experience with a PRMD. Anxiety and frustration were terms used by multiple participants in order to describe their feelings while injured. Also, an identifiable trend among multiple participants' stories is asking themselves what they would do if they could no longer drum. This connected to concerns surrounding losing drumming as a passion and as an income source. For many participants, emotional challenges stemmed from considering the worst possible outcomes from injury. Furthermore, an identifiable psychological impact of some participants' experiences is detachment from drumming, enabling them to combat emotional challenges. One participant shifted their mindset so that drumming is no longer who they are, but rather an activity they do, thus detaching drumming from their identity. Another participant's detachment from drumming involves expanding beyond drumming to find other activities that she enjoys. Furthermore, one participant said that time spent away from drumming in order to heal has made him a little bit more detached from drumming, which he thinks is good because it decreases his expectations. Similarly, one participant described how lower expectations in relation to drumming help him make peace with not being able to accomplish everything he wants to on the drums due to injury. Despite the various challenges of PRMDs, 8 of the 10 participants were able to identify one or more positive outcome from their experience with a PRMD. Frequently mentioned positive outcomes related to increased awareness towards the potential for injury while drumming, increased bodily awareness, and improved technique or facility playing drums. One participant highlighted how increased bodily awareness has directly resulted in improved drumming. Based on participants' experiences, 3 conclusions can be drawn about bodily awareness. First, bodily awareness can be a positive result from experiencing a PRMD. Second, it can support PRMD prevention, as some participants described using bodily awareness to prevent injury. Finally, bodily awareness can lead to better drumming technique and facility. Overall, through comparison, some participants equated the needs of drummers to those of athletes, asserting that drumming PRMD risks, resources, prevention, treatment, and care should be comparable to sports medicine. First, a comparison is made as drummers like athletes experience PRMDs, but the participant highlights how more research and specialized care for drummers' PRMDs is needed, like what is available for sports injuries. Next, a comparison is made as one participant related sports and drumming as both are physical and require bodily care, but he expressed how there's a lack of information available for drummers on injury prevention. A third comparison is made as one participant described how athletes like drummers must often continue working despite injury. She enjoyed her experience seeking care from a physiotherapist, as they were more understanding of this from dealing with athletes. This statement also reveals how athletes and drummers can receive similar care for PRMDs. Another comparison stated by this participant is how bodily aging affects drummers like athletes. Based on participants' experiences navigating PRMDs, 3 conclusions can be made about drumming education in relation to PRMDs. First, drum kit instructors can play a role in supporting injury prevention and navigation among their students. Next, professional drummers who have experienced a PRMD can use their knowledge gained from injury to educate other drummers about PRMD treatment and prevention. And last, drum kit instructors can face challenges related to teaching drum lessons when injured with a PRMD. Ultimately, knowledge gained from this research can support successful PRMD management and prevention among drummers and other key figures in recovery and prevention. Through exploring lived experience, it produces valuable information about drumming PRMDs that should be taken into account alongside medical perspectives. Although a small sample size of professional drummers was used, significant new insights emerged through this study that could have only been revealed through investigating lived experience. The experiences, choices, and opinions of drummers with a current or past history of PRMDs can be further investigated in order to answer questions such as: how can professional care be improved for drummers with PRMDs? How can sports medicine practices and culture positively influence treatment and prevention strategies for drumming injuries? Would changes to the culture of professional drumming and drum teaching reduce the risk of PRMDs? What strategies can music educators use to prevent injury among drumming students? Are there effective and practical methods of avoiding particular drumming-related PRMD risk factors? With the answers to these questions, perhaps one day professional drummers will stop taking such a beating. As I mentioned earlier, the research paper is currently unpublished, but hopefully at some point I can make more of this study available. There's so much more that I would love to share. I hope this video has been useful to you. If you're an injured drummer, just know that you are not alone and that there are ways of treating and preventing PRMDs, as well as overcoming many of the challenges that they present. Thank you so much for watching. Take care.